Hi, my name is Luke Canada. I'm a family nurse practitioner student at University of Alabama in Huntsville. Today we're going to be doing a comprehensive diabetic foot examination. So we begin by talking to the patient about his diabetic history, what his last hemoglobin A1C was, what his last fasting blood sugar was, what medications he's on, who manages his diabetes, as well as any complications from the diabetes, any current diabetic neuropathy, any nephropathy or retinopathy, as well as how long he's had the diabetes. Then we go over a review of systems. This will include looking for any diabetic symptoms like polyuria, polydipsia, polyphagia, as well as any joint problems, any previous joint problems or musculoskeletal issues, as well as any previous foot problems. So we'll begin by inspection. First, I'll just inspect the feet for any obvious calluses or ulcers, any cracks or xerosis or dry skin. There's a little bit of dry skin here, so we can use a proper diabetic lotion to prevent any maceration and get this taken care of before it cracks or bleeds. Also looking at the nails for any onychomycosis in between the toes for any tinea pedis or athlete's foot, as well as the bottom of the foot for any fungal infection as well. Next, we can begin examining testing circulation. We'll begin by feeling for the dorsalis pedis pulse on the top of the foot, and it's a good 3+ pulse, as well as the posterior tibial. Again, that's 3+. Then we'll look at the capillary refill, which is another test for circulation in the feet. You should blanch the pink of the nail beds down and see a return of the color in less than 3 seconds. And if you don't, then that can be a sign of decreased circulation, possibly due to the diabetes. Then I'll look at the ankle for any edema, any swelling. And there's none. And also the temperature of the foot in general. It's fairly warm, so you know there's pretty good circulation. Then we'll move to using the Sims-Weinstein 10-gram monofilament. Has about a 77% sensitivity with a 99% specificity. We'll have the patient close his eyes and then tell me when he can feel the pressure of the monofilament, and if he cannot, then that's an obvious sign of diabetic neuropathy, and that can be an indication of future danger of developing ulcers just because of the unawareness of what's going on with the foot. So I'll begin testing and have the patient tell me when he can feel it.
Yes. 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 Yes.
Okay, good. And so I just tested the plantar surface of the toes, as well as the metatarsal heads, number 1, 3, and 5, the heel, and the dorsal surface of the foot using the monofilament. Next, we'll move on to using the tuning fork. This has about a 53% sensitivity with a 99% specificity. And usually with diabetic neuropathy, you'll lose the sensation of vibration first, and that can be an early warning sign to developing neuropathy. So I'll demonstrate the vibratory sense maybe on the wrist of the patient to let them know what it feels like, and then I'll put it here on the distal hallux, and the patient should, you feel that?
Yes.
And then they'll no longer feel it. About the same time I can't feel it in my hand, and that would be a normal vibratory sense.
Yes.
You still feel it?
No.
No? Okay. So that is normal testing there. Then I'll go on to sensation of sharp and dull. I like to use a paper clip for the sharp and just a regular Q-tip for the dull. So again, I'll have the patient close his eyes and tell me when he feels sharp or dull.
Sharp, dull, dull, sharp, dull, sharp.
Okay, good. And next we'll move on to reflex testing. It's a neurological test of the heel, and you should just see if you can elicit the reflex. It's sort of tricky, but you'll see a plantar flexion of the foot, and that would just indicate intact reflex and no complication of diabetic neuropathy. Next, we'll use this visit to go over education of the patient. While he's here, we can examine the shoes, make sure they're not too wide or too narrow or too tight or too loose. He has a good insert here for arch support, and we make sure that tell the patient not to tell the patient to look inside the shoe and feel with the hand every time they put the shoe on. As if there's any diabetic neuropathy, they may not know there's a rock or other debris which can quickly cause an ulceration and possibly infection. And we'll go over the importance of checking the feet daily, telling the patient to inspect, to look for any dampness or any fungal infection between the toes, to make sure that the dry skin is treated properly, to make sure if there's any new calluses or corns or bunions here, that we get those taken care of. And also to tell the patient that if they're diabetic patient currently with no peripheral neuropathy, that they should still get their feet examined every year by either their specialist, like the podiatrist. If they do have diabetic neuropathy, it may need to be every 6 months, and if they have any current ulcers or anything, it may need to be every 2 to 3 months to follow up treatment for that. And also earlier we were examining the arch as well. Forgot to mention that, and there's good arch here, and no calluses or ulcerations. So that about does it. Again, I'm Luke Cannon, a family nurse practitioner student at UAH in Huntsville. This is a comprehensive diabetic foot examination, and thank you for watching.